Hey guys, this is Dr. Cindy with your weekly health tip, and what I wanted to talk about is when it comes to healthcare, what I've learned over the years is the sense of urgency to act and intensity with a situation. So the biggest thing I can tell you, and if you ask any doctor, they'll agree with me on this, is that when you have a health issue, let's say you are having the dizziness, numbness in the body, low back issues, your energy's off, and it's not that big of a deal, that's when you should do something about it, because I can tell you almost 100% of the time when there's a health issue, if there's a problem in your body and you leave it, do you think it gets better or does it get worse? Almost 99% of the time it will get worse because you're just leaving it and the body just decays and it's losing function. So if I could share anything with you, if you have any issue, take care of it right away. And if something's a true principle, it won't apply in healthcare, it'll apply across the board. So if you have a little financial issue, that's when you take care of it. You don't wait till you're almost bankrupt. If you have a problem in your relationship with your spouse, you don't want to wait till it's so bad and you guys are talking about divorce. When you see the little problems, take action, and it totally applies to the human body. So, and here's the thing too, you know, as much as we get great results in this office, if you wait too long to take action, also with the human body, there's a good chance you'll end up with a permanent situation. So there may be a situation where you're having numbness or tingling in the body, it's on and off, now it's getting more frequent. If you wait too long for anything, there's also a certain window that I would like to call like a healing window, that if you take action, the body will come back. If you pass that certain window, you can end up with a permanent situation, and no one would want something like that. So obviously in this office, by working with the spine to help the whole body work correctly, if someone actually has a misalignment blocking the nerves and it stays there for years and years and years, yes, we'll get results, but there may be a permanent situation which we don't want to avoid, and then the only option may be drugs for the rest of your life or surgery, which is, again, you know, yes, it saves people, but again, very hard on the body. We want to save that as the last resort. So we always want to go natural. We want to be proactive. You have a better quality of life. And a common question I also get is that we've had people come here, feel wonderful, and they're like, okay, now that my headaches are gone, now that the back pain's gone, my energy feels wonderful, do I still have to take care of myself? Do I still have to come in occasionally to have my spine checked? And my answer is absolutely yes. What you have to remember with the human body, it's dynamic from day to day. It's changing what you're eating, the stress you're getting exposed to, what you're lifting, you're bending if you have a slip or fall. It's constantly under stress. It's constantly a structure that's moving. So you may come and have the spine aligned and you're feeling fantastic, but later on in the week you do some lifting, didn't eat the best food, you get exposed to stress. So the body does need constant attention. The spine does need constant attention. It's not something like a piece of metal which you bend into place and it stays there. It's always moving, so it needs to be taken care of. And if you think about it with wellness things, they need to be done on an ongoing basis. Surgery is extreme trauma care. You do it once, you should be done. With wellness care, so yoga, you do on an ongoing basis. Drinking water on an ongoing basis forever. Exercising, eating well, wellness things to keep the body healthy, because I think that the body's like a garden, you have to do forever. And taking care of the spine on a regular basis, yes, it has to be done on a regular basis. The only difference would be that in the beginning when we usually see patients, it's more frequent, and then we can spread out that frequency. But this is something I practice myself. I cannot imagine on a weekly basis I get my spine checked. I'm 99% of the spine getting my spine checked. There may be 1 or 2 weeks in the year that I miss, but I know that week is just not the same, and I still eat good and I still stretch and I'll do my exercises. But if you're not getting your spine maintained on a regular basis, it leads to sickness, it leads to disease, and there may be permanent damage which could have been avoided, which is not a way to live. So be urgent about your health, take care of yourself, take care of the spine. It does need ongoing care. That's just the way it is, because the body's not static, it's always moving. The other thing I wanted to share with you as well is at the end of the month, again, I'm very excited. We're at the Living Arts Center. We have Power Weight Loss. It's filling up. It's always our biggest class. So this time it's at the Living Arts Center. I'm going to, again, go over some of the basics, but bring in new information, new research. A lot's changed. It's always changing for your benefit. We actually have a lady who's in her clinic right now. She's so excited. Month of care, she's already lost 4 pounds. So she's listening to what we're telling her. She's putting it into action. She's seeing changes, which is awesome. So if the excess weight comes off, our results are better. The spine does better. The whole body functions at a higher level. So if you think you may need to lose 5 or 10 pounds or anything more than that, you got to come to this class. And when you come, bring your friends. bring some guests. We want to teach as many people as possible this information so we can save lives, see less diabetes, less heart attacks, less obesity, so people have a better quality of life. So I'll see you there. God bless, and I'll see you next week.